We think the coolest thing about VOX really is that it takes the whole process into account. So it takes the pre-operative process, the hospital process, and the post-operative process, and takes the patient all the way through their hip or knee replacement. And if you can have that patient in a better medical state when they go into surgery, if you've got them really tuned up before surgery, which VOX allows us to do, then you're likely going to have a shorter hospitalization, which is a good thing, and you'll likely have a quicker recovery. So VOX is pretty neat because it takes you from start to finish.
Healthcare is changing quite a bit, and to be successful in the future, you've really got to address the changes that are out there. You've got to meet them head on. We've really got to look at the full continuum of care for the patient before they come into the hospital to well after their discharge. It's no longer just the hospital stay. We've got to be dealing with those patients and working with them well before they're in the hospital, so they're prepared, they come in. And then when they're in the hospital, they receive the appropriate care, less anxiety, they have great outcomes. And then once they're discharged, we need to continue following them so we can avoid problems where you have readmissions or any issues with those patients. So basically took the model that we have, has been successful, has been developed over the last 20 years, and it models to take care of that patient well before and after. So you've taken that instrument, that model that we have, the patient care handbook and all the care around that patient, and put it into an innovative product. Our clinical team has been highly involved with VOX, really collaborative, integrative effort to get this thing going.